Hello and welcome to Differential Discussions. I'm Melissa,
And I'm Dave.
and today we're going to be looking at a couple of slides, multiple myeloma, also known as plasma cell myeloma, and a plasma cell leukemia. And we have a guest with us today. We have Anas, who also has a YouTube channel called Only Cells, and all of that will be linked in the description. So please feel free to check it out, and then you can check out his channel. So welcome, Anas.
Thanks for having me, guys.
Yeah, so Nas, if you'd like to say a little bit about yourself, if you like, it's up to you. Freedom.
Sure. So, as Melissa mentioned, my name is Anas. I am a biomedical scientist from the UK. I work in London in a major hospital. I specialize in hematology and transfusion, and I love blood films, which is why I agreed in a heartbeat when Melissa suggested we should do a collaboration together.
Yay. So what do you say, Nas? Do red blood cells look the same over in London as they do here in the United States?
They look pretty much the same.
It sounds good. Awesome. Cool.
All right, so here we're going to start on 40. And really, this is to kind of talk about finding, again, that good area, seeing the red blood cell morph. So here's 40. Here's a fairly okay area, but kind of thin. And if we go a little bit thinner, you can see we're in the feathered edge.
Yeah, and we're just using the 40 as a substitute for 10. Still, the recommendation always is start your diff, start your scans on 10x, get a lay of the land, so to speak, and then move down. But 40 works best for our particular application here. But just a note. So yeah.
So I think in the feathered edge, it's just important to note that it almost looks like agglutination.
Mm-hmm.
And there's no central pallor, but it's just, again, the feathered edge.
I'm also noting personally that the white count seems to be a bit low too.
Yep.
I think the other thing is we didn't go very far, and this is what we have.
Right.
It's already looking like we're in a thicker area, but we're not.
And so one of the clues that we're not, excuse me, Anas, please.
No, go ahead.
One of the clues that we're not in a thick area is the nice central pallor on the majority of the red cells here. Yeah.
I was just going to mention the other thing that stands out is a variation in the size of red cells. Some are quite big and some are quite small, and that's quite obvious in the slide.
It's a very good point. So we have a pretty high degree of leukocytosis.
What do you guys think? Drop down?
Yeah.
Let's look around.
See what else we can see. Thanks for driving, Melissa. I get the easy job.
Right. So yeah, you can definitely see those differences in size that Anas was just mentioning.
Yeah.
And then, like Dave mentioned, we have the central pallor. So we know it's not too thick of an area. And because we have the central pallor, we know we're not too thin either. But there's already rouleau.
I'm using my terrible drawing skills, so bear with me, right? I'm kind of pointing to, these two cells are pretty obviously different volumes, right?
And so why don't we take a second and just talk about what is the patho of multiple myeloma / plasma cell myeloma?
Oh boy. So it's a mature lymphoid neoplasm. So I think a lot of the malignant hematological issues we look at are with our acute leukemias, dealing with malignant blast forms. And in this case, we have this malignant clonal expansion of our terminal B cell differentiated plasma cells, right? And you don't necessarily see them in the peripheral blood too, right? Like they're going to be a lot of the clinical presentation of multiple myeloma. It's a lot of a chemistry diagnosis almost too, right? But other things, I think of osteolytic lesions, frequently patients experience, nerve compression problems. We'll have plasma cell tumors in the spine, right? That kind of expanding, pushing on nerves. Yeah.
And of course, Rouleau.
And of course, Rouleau, right? So these terminally differentiated plasma cells produce a ton of immunoglobulins that are basically useless, right, to the patient, and increase the viscosity dramatically. And then that increased protein causes these red cells to form this stack of dimes sort of appearance. Yeah.
Mm-hmm.
This reminds me of why the ESR would also be raised as well in these patients, because you decrease the zeta potential because of the immunoglobulins present in the plasma, and therefore the cells fall down rapidly in your ESR. So it's good to bring in other results as well, which would be affected by what we see on the blood film.
Absolutely. Yeah.
Mm-hmm.
Yeah. This is when I'm teaching with students or interacting with students. We'll be talking about, iron studies and things like that. And it's like, it's not a heme test, but it is a heme test. Very important. Yeah.
Yeah. And the other thing that I just like to mention every time we see Rouleau is agglutination and the difference, the different patho. So we just mentioned that it's Rouleau is a buildup of protein, and agglutination is antigen antibody interaction. So when you report out Rouleau versus agglutination, you are telling the physician a particular patho. So it's important that we get the right terms. Rouleau.
Yeah, it can be diagnostically significant. And we do have videos on evaluating a cold agglutinin, if someone wants to kind of contrast what the picture we're seeing here.
Yeah. What do you think? Move around a little bit, see what we find?
See what the blood film gives us.
See if we have any of those malignant plasma cells around.
That'd be cool.
So nice Rouleau, though.
There is. That's where this slide kind of shines, Also, in my experience, certain if a patient has a really, really high protein level, macroscopically looking at the slide, you can see that blue kind of hue.
It's not a malignant plasma cell, but
It looks quite lymphoid to me.
Yeah, lymphoid, absolutely. And it looks like we might be in a tad of a thick area too, perhaps too, given the but again, area becomes really, really tricky to evaluate appropriately. And with a white count this low, to get to 100 cells, you may have to kind of go a little bit on the thicker side of things.
Yep.
yeah, it does look a little bit thicker.
There's my central tower. Platelet count looks a little iffy too. Some fields look okay, but yeah. This is great for instructing Rouleau.
It shows quite nicely the stacking of the red cells as opposed to, like you mentioned earlier, the agglutination, where they just congeal together, and you can see the stacks here. Yeah, quite nicely.
Beautiful neutrophil.
My favorite cell.
Yeah. Neutrophils are underappreciated, aren't they?
Yes.
I think eosinophils get a lot of love for being glamorous.
And also basophils.
Yes.
But I like my neutrophils. Nice and simple.
Same.
Let's get on with it.
So appears to be like a hypogranular neutrophil, perhaps, maybe?
Is it a hypogranular neutrophil?
Or is it a mono?
Is it a mono? Is it a weird lymph?
Decisions.
So I always like to think of what it's not, and then bring things down. So first of all, we know it's not an eosinophil and it's not a basophil. That's
Yep.
2 down, 3 away. So the lobes could be neutrophil. They look like neutrophil, but it could also be a monocyte. Given the other cells that we've seen, the neutrophil was pretty much normal, wasn't it? It was nicely granulated. And we've only seen a few, like you mentioned earlier. There's very few white cells in the slide. So it's hard to compare it to other cells and see if there's a pattern. But I would probably go it's mono.
I would tend to agree with you.
Yeah.
And I really, it's life affirming the way you spoke about that. So I don't get to speak blood films with people very much. But I always like to start with sometimes what it isn't, You get a bit of decision paralysis, and an individual may not be thinking it's an eosinophil, but that dialogue is kind of important, right? Like, what is it not? And just narrow the scope. And then you come to rest on something that it most likely is. And that's, the appropriate call. So,
And the other thing is, no matter how experienced you are, you're always faced with these cells, which look nothing like in the textbook, as you've seen in all the videos before. And you're like, oh my God, what is this? And so I always find it, helps me to have that dialogue in my mind. What is it not? Let's start with easy things, tick them off, and then you can start focusing on what it could be.
Yep.
And I think that train of thought is really important for newer laboratorians and students.
Yep. And, a lot of them are just so, I remember myself when I first started learning on the job, and the confidence gap is tremendous, right? Like you make it through school, but you know that this is the real deal. You're reporting patient results. And I had a very supportive group of people, pointing at you, Melissa, that really worked with me closely in the lab. And so I always felt comfortable going to someone and asking, right? Hey, what do you think? And I think that's one of the things I love so much about doing diffs in a real clinical setting is that collaboration on these difficult patients. We don't know it all, right? And that was, it took some of the pressure off of me to see that other people, there's going to be these edge calls. And the other thing I stress to students is if you have these, 1 or 2 tough calls on a slide, and let's say that you get it wrong, right? Oh, that was actually a neutrophil, or that was actually you're just deviating the percentage, just a click here or a click there. It's really not going to change the clinical picture. So as much as we want to be right, do your best. It's my philosophy.
Totally agree. Going back to the red cells, another thing that I can pick up, there's some polychromasia as well. Some of them do appear a lot bluer than some of the others.
Yep, I've definitely noticed that as well. And polychromasia can be kind of tough too to call on a slide like this too, so I might be more sensitive in calling it than in the normal film. See a little bit of a large central pallor too on some of these red cells. And central pallor is going to be kind of tricky to, obviously, to when they're stacked on top of each other to be able to visualize appropriately. Be interested to see what the MCH is.
Wishing for that funky cell we saw before
I know.
recording.
They hide when the lights come on.
Seriously.
Yeah, so I think this slide is really good for demonstrating rouleau. Not the best slide if you want to hit 100 white cells, but
no, not at all. Well, and we're getting to the edge, so okay.
All right,
Oh.
we can maybe switch gears or.
Yeah, switch gears. Let me pull up our plasma cell leukemia now.
I'm
Let's hope
scared.
we actually see some plasma cells this time.
Yeah. Here's hoping.
Fingers crossed.
Yeah, I'm pretty sure we're gonna see plasma cells this time.
Oh, that's right. We did peek at this, didn't we, Melissa?
Hold
Oh,
Uh-huh.
wow.
All right, so let's look at it on 40 again.
Brilliant.
So we already know we're gonna see at least one.
Right. So
Yeah.
we're on low power and we're looking around and I'm seeing mononuclear cells and some of which are deeply basophilic. And if we're careful, I see that perinuclear halo, that Hoff.
Mhm.
Hooray.
But I think too, we're in a thinner area here.
Right.
And I don't really see as much rouleau as I did in the last
Right.
slide.
Mm-hmm.
So let me go a little bit thinner just so we can see.
The other thing too is, I mean, an individual that has like active disease, they're likely getting kind of plasmapheresis and things like that. So, you know, hyperviscosity is really bad for the business of circulatory systems. So that's usually dealt with. So it may be that the rouleau is not going to be as pronounced on this slide, and that might be for that particular reason or another.
I'm gonna go back a little bit thicker now.
So yeah, I think we can, if we were doing a diff, we could get to 100 cells pretty easily on this one.
Yeah, I think so. All right, let me pick a cell and drop down.
She picks the ugliest one to look at.
Some say I do it on purpose.
Yes. That's awesome. Beautiful.
Beautiful cells. Yeah.
So it's kind of a lot to take in here.
Okay. Should we start on the one on the left?
Sure, yeah.
So the first thing, it's a mononuclear. There's one nucleus and it's not in the center, it sticks out. It's right on the edge. And that's quite, distinctive and a characteristic feature of your plasma cells. And then just around the nucleus, unfortunately, I don't know how to work the pencil, so I'll let Melissa or Dave do the pointing. You've got that, almost, it's a lighter color of the cytoplasm, the perinuclear halo. And if I remember correctly, that's your Golgi body.
Yep.
Very
Yes.
basophilic as well, and the color is very, very blue, purple.
So, other than it being a malignant cell, like, wow, right? Like, that's a pretty darn good plasma cell, right? Very pleased with that one. So, I think depending on the laboratories, the way that they call and differentiate cells towards the middle, it would be pretty plain to me that this cell is part of the population of cells we're going to see throughout the rest of the slide, right? But this one's maybe not as demonstrating that beautiful perinuclear halo of the Golgi, and it is a little eccentric. It's a little pushed off to the side, but
This guy?
it's not. Yeah, it's not great, right? But I would think that I would call this a plasma cell given the clinical picture on the rest of the slide, right? So I think that's like important that every smear you're evaluating, you should be thinking about the context that the cell's in, right? So not like an amazing plasma cell, but certainly I would think so, just given the context. And then on the right, sorry.
Before you get into the cell on the right, I was just going to mention that point about context. So whenever we look at blood films, they're not, we should not look at them in isolation. A lot of the films that we see, the diagnosis of the patient, we can see in the clinical details. You got your blood results. So, always keep that in mind when you're looking at your blood film. And it will give you a lot of idea about what you're seeing as well, help that make sense as well.
Yeah, 100% agree. So
Well,
Melissa, what's going on there?
I think that's important for this cell because I don't know about you, but whenever I look at a deeply basophilic cell, I tend to think Burkitt. one of the first things that I go to, deeply basophilic with all those vacuoles. But given the context of this, it's probably not a Burkitt. It's probably just a malignant plasma cell.
Yeah, yeah.
Yep.
So yeah, and there's a term for and I don't want to use this term heavily or inappropriately, so I'm gonna defer to you two. But have you ever heard of the call of a Mott cell? MOTT. So I'm seeing those little vacuoles in that lymph, and I'm thinking, like, is this approaching that kind of
It could be. I would, at least for me, I would want more of those little vacuole-like
before
inclusions
you would
inside
say
of the
that?
cytoplasm. It looks like vacuoles only because it's also in on top of the nucleus.
Yeah, right.
What do you think, Anas? You agree?
I totally agree. Yep. In Mott cells, the few that I've seen, there are a lot more vacuoles full of immunoglobulins. Yep, I'd have to see a lot more to be able to call it definitely a Mott cell.
Yeah.
But I
They
can see
usually,
Mott
the
cell.
cytoplasm's like packed, right? Like it's just full of them. And then, as I think too in my mind, they're not perfect vacuoles, right? They still actually have color to them, if I'm like remembering correctly.
Yep.
Whereas these are not like that. Yeah,
Mm.
it's a good point.
Yeah, but that's a good thing to bring up.
Yeah.
All right, let's move around and see what other deeply basophilic things we can find.
Yeah. Right. So in the clinical context, right, maybe we're calling the cell in the top left a plasma cell, perhaps. Depending on the procedure, you might call it more of an atypical or a reactive tissue as well.
In part, I think it'll depend on the flow.
Yeah, probably, I guess. Yeah.
But I liked this field because
there's good contrast there, right? A normal lymph in our abnormal population. And then just to note some smudge cells, right? So some cells ruptured.
Oh my gosh, a normal cell.
Hey.
Too, I feel like we're not in a super thick area and there is some evidence of rouleau still.
Yep.
It's just not quite as striking as the other slide.
Yeah, I agree.
But I think we have two more of those plasma cells here.
Agreed.
Yep. And you can quite clearly see the light area in the cytoplasm as well around the nucleus.
Yep.
On both of them, especially the one on the left, is quite prominent.
And there.
Yeah.
Yep. Yeah, and so like if these are the first two cells I saw on the slide, I may be thinking more of a reactive process, but it's in the picture and context, as Anas said, that you really start to develop like, okay, this is part of our clone, our malignant clone, probably.
Yeah.
Ooh.
Oh, wow.
Interesting.
Well, hello there.
Fancy seeing you here.
Yeah. So so it looks like granulocytes have joined the party. So this is an immature granulocyte, looks like, right? So what would you call it, Nas?
It's big. You got a single nucleus. It's granulated. I'd probably go for a myelocyte.
Yeah, so it's definitely somewhere on that continuum of maturation. So
Yeah.
I love that deep basophilic in the bottom of the. What a beautiful cell.
Yeah, I think he's somewhere in between a pro and a myelo.
Yeah, he might be.
You can see, I don't know how well you guys can see this, but I can see that there's a really nice nucleoli right there. And it could be remnanting, like we're going towards the end of it, which makes me think it's in between the two, the pro and the myelo, definitely. But it's definitely an immature gran and not a plasma cell.
Yeah, so and that's what's interesting about this, because I could totally imagine someone who's inexperienced at learning could see, you have a little bit of a Golgi clearing on the right? If I'm going to be devil's advocate here, right? You have that basophilia in the bottom of the cell, right? But overall, the thing that should kind of yell out to you a little bit here is that color of the cytoplasm is not right? It's just too. And then the nucleus itself is not representative of the nuclei that we're seeing in our plasma cells, which is much more mature, much more clumped and condensed. So yeah. And then a ruptured EO. We can't forget our EO brother in the field as well. But then I would say 2 other plasma cells.
But wait, does this mean we have a malignancy of our neutrophil cell?
I mean, for the most part, this cell morphologically looks fairly normal. If not just like some maybe a product of a stress kind of push.
That's
and
what I was going for.
yeah. And then what might some of these patients be receiving? That they may, if they're experiencing that myelospecific anemia, you might push something like a granulocyte colony stimulating factor to increase the amount of neutrophil cells in the body. So it's not uncommon, right, for us to see leukemic patients kind of trying to get their ANC up. So.
Yep.
It's a cool slide, though. Hey, I like
Very
this.
nice.
I like those
Small.
little cytoplasmic
Yeah.
projections too. A little abnormal.
He's small for a plasma cell, but given that it's a malignancy, they're not going to follow any atlas or textbook. Let's look at a couple more fields, see if we can find anything else.
I love how one of the cells you just passed, the nucleus is like perfectly round. I kind of want to point that out too, because that's sort of a signal. Yeah. So lymphs have round nuclei, but in my experience, they're not like perfectly round, right? Like that shape there just triggers like plasma cell to me. Yeah.
And the clumping of the nucleus as well. So not just the shape, but also the clumping. It's very, very clumped. It almost reminds me of, somebody doesn't moisturize the skin enough and the skin starts to crack. And that's whenever I see a plasma cell and that's sort of nucleus, I'm like, oh, they need a bit of hydration. Get some moisturizer.
That's fantastic. I've never thought of that.
I love these kinds of discussions because we all have our own like dialogues, right? About how we kind of think about like the tech, because I always talk about like texture as if I could touch these things, right? But they're just these little games we play with our minds. But that's a funny one. I like that. I need some lotion on my hands, to be honest. The winter's been brutal. Yeah, we talked about CLL lymphs, and they get this kind of we'll say football, given our guess, right? This football kind of pattern. And I'm seeing it in the plasma cells too. It's definitely something that you'll see at this kind of these yeah.
And the loss of contact inhibition.
Yeah, they're all kind of stuck together, right? It's always a red flag to me.
Yeah, absolutely. You want to look at another field, or you think we can stop with this one?
It's up to you. I don't. I think. You see anything else interesting in your scans? You have a wider field of view than me.
More of the same. Or I guess we can end on this guy here.
Oh, so talk about a nice dichotomy here, right? With on the cells on the right. So we have one of our malignant plasma cells, and it appears to be a normal resting limb.
And then this guy also looks like a normal resting lymph, but he's got little clefts in here.
He's not the prettiest, but we still appreciate him.
Yeah.
I also noticed it looks like there's some really deeply staining platelets in some of these fields. I don't know if you saw those abnormal platelets too. Yeah.
Yeah, absolutely.
And that's quite a big one as well, isn't it?
Mm-hmm. Quite.
Yeah.
All right.
Awesome. Well, I think that's all for this video and looking at the cells. But if you're interested in seeing how we would actually report out the results for this video in the differential, well, maybe not the diff, but more the morphology portion of it, then you can join us for our second part where we talk about reporting out the results. And you can find that on Anas's channel, Only Cells, which again will be linked to in the description. So Anas, thank you for joining us today.
Deeply
Thank you for having
appreciated.
me. Like that neutrophil on the bottom left, thumbs up.
Yeah. Absolutely. All right. And everybody else, thanks for watching.
Thanks for your time.
Please like, subscribe, and hit the bell if you'd like notifications whenever we post a new video. And feel free to reach out to us on social media or via email with comments or suggestions about future content. Thanks.